Hey there, gentlemen. Let's talk about something most doctors won't bring up during your routine checkup. And yes, it might feel a little awkward, but it's important. If you've stopped masturbating in your later years, your body may already be quietly breaking down, and you probably don't even realize it. This isn't locker room talk. It isn't some internet rumor. This is real clinical physiological truth. Ignoring it can affect your sexual health, your brain, your heart, your sleep, your immune system, and even how you feel about yourself. I'm Dr. Jocelyn, a urologist and men's health specialist with 5 years of experience helping older adults understand how their bodies change. Today, I'm going to walk you through what happens when masturbation disappears from your life. And trust me, it may completely change how you look at your health. Before we dive in, do me a quick favor, hit that like button, comment below where you're watching from, and subscribe so you never miss practical tips that help you stay sharp, independent, and healthy as you age. Here's something you might not expect. Masturbation isn't just a leftover impulse from your youth. It's actually one of the most powerful ways your aging body can maintain hormone balance, protect your prostate, boost your brain, and even fight depression. And if you've stopped or never really kept it up, the cost could be higher than you think. In the next few minutes, I'll show you exactly what happens inside your body when sexual self-care stops and what you can do about it. In my practice, I see this all the time. Older men come in fit, active, proud, but quietly. They've abandoned a simple, natural habit. And the consequences? They're surprisingly serious. Masturbation isn't just about pleasure. It's about function. Function of your prostate, your brain, your pelvic muscles, your hormones, your sleep, and even your immune system. Think of it as a small but mighty daily maintenance tool for your body. Let's go through 7 major consequences of stopping masturbation in later life. I'll explain what happens biologically, emotionally, and practically. Number 1, decreased prostate health and urinary function. I had a patient in his early 70s fit, sharp, who kept waking up 4 or 5 times a night to urinate. He had no idea that regular ejaculation, even solo, helps keep prostate fluid moving. Without it, fluid can stagnate, leading to inflammation, swelling, and pressure that disrupts urination. You might notice a heavier bladder, a weaker stream, or discomfort that doesn't go away. Emotionally, it's exhausting sleepless nights, anxiety about leaving the house. Suddenly, your independence feels threatened. Practically, it might mean frequent bathroom breaks, disrupted routines, or even surgery down the line if ignored. Regular ejaculation flushes the prostate, reduces inflammation, and even lowers risk of prostate cancer. It's simple biology protecting your body. Number 2, cognitive fog and reduced mental clarity. I had another patient in his late 60s who said, "Doc, I just don't feel like myself anymore. I forget why I walk into rooms. My mind feels foggy." Here's what's happening biologically. Sexual activity releases dopamine, serotonin, and oxytocin chemicals that protect memory, focus, and emotional regulation. Stop masturbating for months or years, and those protective surges disappear. Emotionally, you feel less sharp, less capable, and maybe even less confident. Practically, it affects your work, hobbies, and social life. One man quit his chess club because he couldn't concentrate. Another, a retired teacher, told me he felt blank every morning. It's subtle at first, but over time, this cognitive drift can become a real challenge. Number 3, heightened depression and emotional numbness. I treated a 72-year-old widower who told me, "I don't feel anything anymore. Not sadness, not joy, just flat." Masturbation releases endorphins and oxytocin, your natural stress relievers. Without it, emotional numbness can creep in, sometimes evolving into depression. Emotionally, you feel disconnected from yourself and others. Practically, hobbies, social interactions, sleep, and even appetite may suffer. While therapy or medication can help, sometimes simply reconnecting with your own body can make a profound difference. Masturbation isn't indulgence, it's emotional maintenance. Number 4, poorer sleep quality. Another patient, also in his late 60s, suffered from chronic insomnia. His labs were fine, but his intimate life had been long forgotten. Orgasms trigger oxytocin, prolactin, and endorphins, chemicals that shift your nervous system from stress mode to rest mode. Missing this means fragmented sleep, fatigue, weaker immunity, poor cognition, and higher disease risk. Emotionally, fatigue saps motivation, Practically, it affects independence, social engagement, and overall quality of life. Sleep and intimacy are linked in ways many men never realize until problems appear. Addressing one can restore the other naturally. Number 5, weakened pelvic floor and circulation. I once treated a retired firefighter who complained of urinary leakage and hip and back discomfort. His pelvic floor muscles, which are key for bladder and core support, had quietly weakened over time. Masturbation stimulates rhythmic pelvic floor contractions, essentially exercising vital muscles. Without it, circulation slows, tissue elasticity drops, and nerve response diminishes. Emotionally, this can feel like your body is betraying you. Practically, urinary dribbling, difficulty standing, and sexual dysfunction can become daily struggles. Regular sexual self-care helps maintain these muscles and supports overall function. Number 6, lowered immune function. Sexual activity boosts IgA antibodies and reduces inflammation. Stop masturbating for months or years, and your immune system misses a natural defense boost. I've seen patients who suddenly get sick more often, recover slowly, or experience flare-ups of chronic inflammation. This isn't just minor illness, it can affect long-term disease prevention and recovery. Emotionally, frequent illness can lead to frustration, stress, and low mood. Practically, it impacts energy, independence, and the ability to enjoy life fully. Masturbation, in its physiological simplicity, supports resilience and overall health. Number 7, loss of body ownership and self-worth. Neglecting self-intimacy can make you feel disconnected from your own body. One patient in his late 70s said, "I feel like I'm just inhabiting my body, not living in it." Emotional and psychological distance forms when you stop caring for your physical self. Masturbation, even private, gentle, non-sexual self-touch, reminds your nervous system, "I matter, my body matters." Emotionally, it restores dignity. Practically, it encourages self-care, physical activity, and engagement with life. Small, consistent attention to your own body reinforces confidence and health simultaneously. So, what can you do starting today? First, reintroduce self-touch safely and privately without guilt. It's not about obsession, it's about maintenance. Aim for consistency. Frequency isn't a measure of desire, it's a tool for bodily upkeep. Pay attention to your pelvic floor muscles. Gentle Kegel exercises can help support function, improve circulation, and maintain nerve responsiveness. Pair intimate self-care with healthy lifestyle habits. Sleep well, eat nutritious foods, and get light exercise. Observe changes in your mood, energy, and sleep patterns. You'll notice small improvements quickly, often within days or weeks. These aren't dramatic interventions, they're simple, effective ways to reclaim control over your body and mind. I know this topic can feel awkward or even shameful. That's normal. But reclaiming intimacy isn't about lust, it's about health, cognition, sleep, and dignity. Small, consistent steps today can restore energy, independence, and confidence. Age does not mean vitality ends. It's about protecting your body, maintaining function, and feeling alive in your own skin. Remember, this isn't about going back to your 20s. It's about understanding your body, supporting your mind, and taking ownership of your health. When men approach sexual self-care as a form of maintenance rather than indulgence, they often experience better sleep, improved immunity, healthier prostate function, and enhanced emotional well-being. Practical, biological, and psychological benefits come together, quietly reinforcing overall quality of life. Here's the final takeaway, gentlemen. Passion does not retire. Your 60s, 70s, even 80s can be your most connected, most confident years if you let go of shame, embrace acceptance, and care for your health together. Don't waste money on gimmicks, quick fix supplements, or unsafe pills promising instant results. True confidence comes from understanding your body, maintaining honest conversations with yourself, and practicing consistent self-care. Care for your body, maintain intimate routines, and approach your health and sexuality as a shared, joyful experience. When you do, every touch, every movement, every moment of connection becomes meaningful, safe, and deeply satisfying. Your sexual health, brain function, sleep quality, and emotional well-being are all intertwined. Reintroducing masturbation and self-intimacy supports each of these systems simultaneously. If this video resonated with you, hit that like button, subscribe to the channel, and share it with another man who could benefit from this guidance. Leave a comment telling me where you're watching from and what topics you'd like me to cover next. Small, consistent actions reclaim comfort, freedom, and confidence. Intimacy isn't just mechanics, it's trust, self-respect, and understanding your body's signals. Remember, age does not define vitality. Small, thoughtful steps, rebuilding habits, supporting your mind and body, staying attentive to your health bring energy, independence, and a renewed sense of masculinity. Your body is adaptable. Your mind is resilient. Your sexual confidence and self-worth are not measured by age, performance, or metrics. They are measured by your commitment to yourself, your health, and your relationships. I'm Dr. Jocelyn, and remember, passion does not expire, and neither should you. Start today. Care for your body, honor your mind, and embrace intimacy as a natural, vital part of life. Small changes create lasting freedom, comfort, and confidence. Your body, your mind, your life, take ownership, and let vitality flourish.